How to pass your NCLEX practice exam on the first try, 2026. Question 1. Regam is most often used to treat which combination of mother and infant? Option A, Rh-positive mother and Rh-positive infant. Option B, Rh-positive mother and Rh-negative infant. Option C, Rh-negative mother and Rh-positive infant. Option D, Rh-negative mother and Rh-negative infant. The correct answer is option C, Rh-negative mother and Rh-positive infant. Regam is given to an Rh-negative mother to prevent her immune system from developing antibodies against the Rh-positive red blood cells of her infant. Question 2. A 24-year-old female is admitted to the emergency room for confusion. This patient has a history of a myeloma diagnosis, constipation, intense abdominal pain, and polyuria. Which of the following would you most likely suspect? Option A, diverticulosis. Option B, hypercalcemia. Option C, hypocalcemia. Option D, irritable bowel syndrome. The correct answer is option B, hypercalcemia. Multiple myeloma destroys bone tissue, releasing massive amounts of calcium into the bloodstream, leading to confusion, constipation, and polyuria. Question 3. You are taking the history of a 14-year-old girl who has a body mass index of 18. The girl reports inability to eat, induced vomiting, and severe constipation. Which of the following would you most likely suspect? Option A, multiple sclerosis. Option B, anorexia nervosa. Option C, bulimia nervosa. Option D, systemic sclerosis. The correct answer is option B, anorexia nervosa. A critically low body mass index coupled with food restriction, induced vomiting, and constipation are classic criteria for anorexia nervosa. Question 4. A 35-year-old male has been an insulin-dependent diabetic for 5 years and now is unable to urinate. Which of the following would you most likely suspect? Option A, atherosclerosis. Option B, diabetic nephropathy. Option C, autonomic neuropathy. Option D, somatic neuropathy. The correct answer is option C, autonomic neuropathy. Autonomic neuropathy is a complication of diabetes that damages the nerves controlling involuntary bodily functions, including bladder emptying. Question 5. A second-year nursing student has just suffered a needle stick while working with a patient that is positive for acquired immunodeficiency syndrome. Which of the following is the most important action the student should take? Option A, immediately see a social worker. Option B, start prophylactic azithromycin treatment. Option C, start prophylactic pentamidine treatment. Option D, seek counseling. The correct answer is option B, start prophylactic azithromycin treatment. Post-exposure prophylaxis with antiretroviral therapy, like AZT, must be started immediately to reduce the risk of viral transmission. Question 6. A 34-year-old female has recently been diagnosed with an autoimmune disease. She has also recently discovered that she is pregnant. Which of the following is the only immunoglobulin that will provide protection to the fetus in the womb? Option A, immunoglobulin A. Option B, immunoglobulin D. Option C, immunoglobulin E. Option D, immunoglobulin G. The correct answer is option D, immunoglobulin G. IgG is the only class of immunoglobulin small enough to effectively cross the placental barrier and provide passive immunity to the fetus. Question 7. You are responsible for reviewing the nursing unit's refrigerator. Which of the following drugs, if found inside the fridge, should be removed? Option A, Nadolol. Option B, opened and use humulin N injection. Option C, urokinase. Option D, B-Poetin alpha intravenous. The correct answer is option A, Nadolol. Nadolol is a beta blocker that should be stored at room temperature, protected from light and moisture. Question 8. A patient tells you that her urine is starting to look discolored. If you believe this change is due to medication, which of the following of the patient's medications does not cause urine discoloration? Option A, sulfasalazine. Option B, levodopa. Option C, phenolphthalein. Option D, aspirin. The correct answer is option D, aspirin. Aspirin does not cause urine discoloration. Sulfasalazine turns it orange, levodopa turns it dark, and phenolphthalein turns it pink to red. Question 9. A nurse is reviewing a patient's past medical history. This history indicates the patient has photosensitive reactions to medications. Which of the following drugs is associated with photosensitive reactions? Option A, ciprofloxacin. Option B, sulfonamide. Option C, norfloxacin. Option D, sulfamethoxazole and trimethoprim. Option E, isotretinoin. The correct answers are options A and B and C and D and E. Ciprofloxacin, sulfonamide, norfloxacin, sulfamethoxazole and trimethoprim, isotretinoin. All listed medications, fluoroquinolones, sulfonamides, and retinoids, are well documented to cause moderate to severe photosensitivity. Question 10. A nurse is reviewing a patient's medications during shift change. Which of the following medications would be contraindicated if the patient were pregnant? Option A, warfarin. Option B, finasteride. Option C, selexib. Option D, clonidine. Option E, transdermal nicotine. Option F, clofazimine. The correct answers are options A and B. Warfarin, finasteride. Warfarin causes fetal hemorrhage and teratogenesis. Finasteride can cause abnormalities of the external genitalia in a male fetus. Question 11. A nurse is administering blood to a patient who has a low hemoglobin count. The patient asks how long red blood cells last in the body. The correct response is Option A. The lifespan is 45 days. Option B. The lifespan is 60 days. Option C. The lifespan is 90 days. Option D. The lifespan is 120 days. The correct answer is option D. The lifespan is 120 days. A healthy red blood cell circulates and functions optimally in the human body for approximately 120 days before being destroyed by the spleen. Question 12. A nurse is putting together a presentation on meningitis. Which of the following microorganisms has not been linked to meningitis in humans? Option A, Streptococcus pneumoniae. Option B, Haemophilus influenza. Option C, Neisseria meningitidis. Option D, Clostridium difficile. The correct answer is option D, Clostridium difficile. Clostridium difficile primarily causes severe gastrointestinal infections and is not an infectious agent associated with central nervous system infections. Question 13. A patient asks a nurse which types of foods contain the highest concentration of folic acid. The correct response is Option A, green vegetables and liver. Option B, yellow vegetables and meat. Option C, carrots and sweet potatoes. Option D, milk and dairy products. The correct answer is option A, green vegetables and liver. Dark leafy green vegetables and organ meats like liver are the richest natural dietary sources of folic acid. Question 14. A client with myocardial infarction is receiving tissue plasminogen activator. While on therapy, the nurse plans to prioritize which of the following? Option A, observe for neurological changes. Option B, monitor for any signs of renal failure. Option C, check the food diary. Option D, observe for signs of bleeding. The correct answer is option D, observe for signs of bleeding. Tissue plasminogen activator is a potent thrombolytic. The highest risk complication is severe hemorrhage, requiring meticulous monitoring for bleeding. Question 15. A mother has recently been informed that her child has Down syndrome. You will be assigned to care for the child at shift change. Which of the following characteristics is not associated with Down syndrome? Option A, simian crease. Option B, brachycephaly. Option C, oily skin. Option D, hypotonicity. The correct answer is option C, oily skin. Oily skin is not a characteristic of Down syndrome. The condition is frequently associated with dry skin, hypotonicity, a simian crease, and brachycephaly.